Welcome to another episode of What Brings You In Today.
I'm Erica Bennett.
And I'm Taylor Fisher.
And today we are here with Lara Davis, registered nurse with labor and delivery at SGMC Health. So Lara, what brings you in today?
I am here to talk about the best place to work in the hospital, which is labor and delivery.
Awesome. Yes, we always say nobody truly wants to be in the hospital except for those mamas that are getting to meet their babies. So tell us a little bit about your background, kind of how you got into nursing and how you found labor and delivery as your home.
Okay, so I always knew I wanted to be in the medical field. Since fifth grade, I just had this love for science, for math, for all these things that like kind of somehow filter into a science degree. Mm-hmm. But I really never thought about nursing in general. Kind of fell into it whenever I decided that was the best place for me. Personality-wise, I am very much, I want to be involved with the patient, make a relationship with the patient, but also be able to like help them in some way. I had a moment whenever I got out of nursing school, went straight into med surg, was not for me. I lasted for a year, but at the end of that year, I was like, I've got to find something different. Briefly considered going into meteorology, which was a complete left turn. But finally found a job in labor and delivery, and it was home. That was it. That was it for me. That was exactly where I knew I needed to be.
I think that's the coolest thing about nursing, and I hear that a lot from nurses when you ask them, like, well, how did you get into, surgery or any kind of specialty? That's the beauty of being a nurse, is that there are different areas that you can try out if you find yourself not liking one and kind of find it. But we're glad you found
Me
your home.
Me too. It took a minute, but it was exactly where I was supposed to be. And it made me appreciate it more when I did find it.
Yeah. And how long have you been with SGMC Health?
This April will be 17 years.
Okay. A long time.
I had that med-surg year was in labor and delivery too, but I had to kind of migrate my way back. Was in South Georgia Medical Center as well, but I had to migrate my way back in.
I gotcha. Well, speaking of labor and delivery and women's and children's services, you've been here a long time. We want to talk to you today, or want you to share your information. You're up there every day, so that we can educate women on what they can expect when they come into the hospital. I kind of spoke earlier with one of our OB-GYNs, and I'm like, a lot of times women are just coming in kind of blind when they're, going to have a baby. You don't really know what to expect, but it's got to happen.
Well, and you have to put your trust in these people that you've just met, but with your baby, in your life, it's a big deal. So it's a very intimidating place to be, but I also think that's why it's so important that we instill that trust in those patients from the get-go. You have to establish that relationship so that they know that they are in good hands and that you're going to take good care of them, and to the best of your abilities, you're going to get them out of here with the experience they wanted to have.
Mm-hmm. How many babies do y'all deliver a day on average?
On average, I would say a really busy day is double digits, more like 10-ish. Some days you'll have just a couple. It just kind of depends. But through the week, I would say an average of 6 or 8. It just depends on the day, though.
But that's fun.
It is so much fun. It's the best. It truly is the best place to work in the hospital. I'm convinced.
Yeah. So mom comes in, dad, or expectant mom, let's walk through the journey, right? Let's say it's a normal pregnancy, not like an emergent. Let's say they go to the doctor. Hey, you're dilated 8 centimeters. Oh, yeah. You need to go to SGMC. And then they come here and they register and they enter the floor of labor and delivery. What are they going to expect? What's going to happen then?
Well, if they're 8 centimeters, we're going to be running. But we have a lot of different options for patients, depending upon whether they want IV pain medication, an epidural, or they want to go more natural route and really just go without all of those things. We have wireless monitors that they can use. In an 8 centimeter situation, they're not going to need any monitor for very long.
Yeah. Well, that was me, by the way.
Oh, good. Okay. Well, you were seeing some of that running. But really, we have those wireless monitors. We have birthing balls. I'm a big proponent of using peanut balls. That sounds like a weird term, but it's kind of like a peanut-shaped yoga ball. And if a patient is, more stuck in the bed, they're restricted as far as their movement goes, whether by pain or what have you, peanut balls are a way to help augment that labor process, make it go a little bit faster, a little bit more efficiently, but in a more natural way. Like it's not pushing medication on them, but it's a way for their body to help progress because we place it in between their legs and use it with movement changes. But if they're wanting to get up and move around, those wireless monitors are an awesome option for them. We've only had those for maybe 3 years. But it's just what it sounds like. It's a little electronic device. It uses Bluetooth in order to talk to our monitor so that we can monitor both baby and contractions the whole time. It's a really great option for those patients who are really wanting to go without an epidural
natural.
or medication. Yeah.
And what are y'all seeing more these days? I mean, I'm sure that's probably
Honestly,
trending.
I've had a
mix
lot more
or what?
patients lately that come in and they really want to do it without anything. And I'm a big proponent of like, whatever you want your day to be, let's do that.
Yeah.
It's honestly one of the first things I ask when I walk in and introduce myself. I'm like, hey, I'm Lara. I'm going to be your nurse today. I just kind of want to know what their idea as far as labor and birth is. Like, do you want to go without an epidural? Do you want to get up and move around? Would you rather be in the bed? Who do you want in here? It's their day. It's not mine. It's not mine to place my prejudice or anything on. Like, I want them to have the experience that they dreamed of. Sometimes it doesn't always work out. Things happen, emergencies happen, and babies do what they want to do. But at the end of the day, hopefully I've made some of their wishes, if not all of them, come true.
So cool. And I think you probably have, because I actually monitor all of our reviews that come through, and we often have them calling Laura by name. So she's a fan favorite from our delivering mamas. But you mentioned the wireless fetal monitoring. Also, within the past couple of years, we got the Angel Eye technology, which is not during labor and delivery. It's more of an after type benefit. But tell us a little bit about that and kind of how it's been helpful for patients or what they're kind of thinking.
So our Angel Eye program, it's honestly, I kind of refer to it like in layman's terms as like FaceTime for babies. Like if babies have to be in the NICU for any length of time, it's a small camera and it literally just sits on their face. It live streams them 24 hours a day. And it's not just a public viewing. Like we send them a link through their email. They download an app, and anytime, day or night, they want to log in and see their baby, they can. Which it's really nice. I mean, nobody ever wants their baby to have to spend time in the NICU, but unfortunately it does happen. And we have a phenomenal NICU. Those nurses over there are the best. But if those babies have to spend time in there, that camera can like be 3:17 a.m. They can log in, they can see their baby, they can get like updates through it. So it's a really nice way to keep in contact with your baby if you have to be separated for any length of time.
And I think we're one of just a handful of facilities within Georgia that has that technology.
Yeah, I believe we were the first of like 3 in the state. So it's really nice that we have that option.
Speaking of NICU, which stands for Neonatal Intensive Care Unit,
Correct.
I think that's probably something people don't really think about unless they're familiar with it because they've had to utilize one before. But tell us about our NICU, what that means for a patient or baby that has to be there, and the importance of having a good NICU, available just because in the event that a baby needs one.
So you never want your baby to have to spend time in the NICU. That's just not something that people ever think about. They want to come in, they want to have the optimal experience, go home with a baby. But unfortunately, sometimes babies come early. There's something going on that we just didn't predict. So our NICU is available. It's a level 2B, which means that we can keep babies as long as they're not intubated for more than 24 hours from 32 weeks gestation and beyond. So those babies get to stay here as opposed to being shipped to a more tertiary care center. So like if a baby doesn't need like some sort of surgery or isn't like one of those micro preemies that's born at like 20 some odd weeks gestation, those kids can stay here, which is awesome because we don't want to separate moms and babies any more than we have to. So we have a specialized team of nurses. We have a neonatologist that's available 24 hours a day. So in the event that we have babies that come early or are just sick, I mean, you can sometimes have a full-term baby that just doesn't come out and do what it's supposed to. They just have to learn sometimes.
Yeah.
But we have that available, which is an amazing thing for our patients. And in the future, we're hoping to kind of advance that up so that we can keep some of those babies that are even younger here. So I'm excited about what the future holds on that one.
For sure.
So we have a lot of other awesome things that are offered
Absolutely.
to birthing moms and parents. Can you tell us a little bit about that? I know we have the cord blood, the placenta donation. Can you tell about that?
Absolutely. So our cord blood donation is through Life South Blood Bank. Whenever we admit patients in any C-section or vaginal delivery, it does not matter on those. We ask them on admission if they are interested in donating their cord blood. I usually explain it to them as it's like a blood donation, like that you would go give, like through your arm. Same idea. It looks the very same. So it's like a needle that hooks up to that cord, does not change anything about the delivery itself. Like we want baby to have everything that he or she needs as soon as they come out. So they want delayed cord clamping, great. Like let's do that. But after that baby has gotten all that it needs, and the cord has been clamped and cut, we can actually access it just like you would a blood donation, put a needle in, withdraw any of that blood that's within the placenta that's left over that truly is just going to go into the trash. We can actually use it. It can be used worldwide for patients for like 70 plus different diseases as a treatment plan for them that otherwise that they wouldn't have. Cord blood matches a little bit easier than like your straight up blood donations. So it's a really good option. And it's not changing anything with their delivery. It's out of the goodness of their heart, but it's a really fantastic way to give back on something that you really don't have any use for at that point. Another thing that we've had recently come up, it's through Telegen. We can actually donate placentas. It used to be that we could only accept ones through C-sections, but more recently, in the past month or so, we've started collecting vaginal delivery ones as well, all under the patient's consent. If there's something going on, there's a screening process. One of the girls from Telegen comes in, speaks to them, kind of explains the process. But that placenta can be donated too. And actually, more recently, because we've been using some of the ones from vaginal births as well, it's just the membrane that they use, but they can actually use it as skin grafts for like burn victims, diabetics. Wow. Very cool program.
Because that has like healing effects. I think you're the one that said the analogy before of like the baby coming out, how you never see a baby with a bunch of scratches or anything, although they're still potentially scratching themselves in the wound. But it's such a high nutrient
it's like those cells
that heals.
Just take over whatever is around them almost. So it's like it can just be used for burn victims. And in fact, this program was started by, not here, but a labor and delivery nurse.
Oh, wow.
And her son then benefited from it because he was in a fire. So very cool that we can use things that, I mean, truly just do not have any other use. I mean, if the patient wants to take it home, that's fine too. Like we have a process for that as well. But it's something that if they don't have a planned use for it, we can use it.
Yeah.
Wow.
That's so cool.
That is super cool.
And then another newer program, a few years we implemented the OB Hospitalist program.
Yes.
Talk a little bit about that because that's 24/7 coverage from an OB-GYN.
Correct. So we now 24 hours a day have an OB hospitalist in-house all the time. So meaning if somebody now, we've changed the guidelines, it's now 16 weeks or greater. If they have a complaint that's OB related, they can be seen in our OB-ED. You're evaluated by a nurse, like one of us. It's all labor and delivery nurses that like staff it. But we kind of evaluate the patient and then we give a report to the doctor and then the doctor comes in and sees you. So like if it's 2:00 in the morning, you've had this issue arise, you don't want to wait until daytime hours, or maybe it's the weekend. You can come in, you can actually be seen by a board certified OB-GYN, which you don't always have access to.
Right.
Like office hours are office hours. But a lot of ours are like familiar to us in the sense that they've either had offices here in town, or they've just been with us for a while. Like they've been with us since the program started.
Yeah.
So it allows our patients to sometimes already have a rapport with them as well, depending upon what's going on. But those are available all the time. And in situations where an emergency arises and like the patient's current doctor is at home, like they're away from, I mean, they're available, but they're not in-house necessarily. That OB-GYN that's in-house can actually expedite the process if there's something going on, and like if there's a C-section that needs to happen now,
Urgent,
we can do it.
Right.
But like if you have a already established doctor, you get seen by this one, everything checks out, look, they can discharge you home. If something's going on, say you're in labor, whatever's going on, they can call your doctor and then they turn over your care to them. So you're not going to be seen by somebody that you just don't know, but it is there as a
safety mechanism.
Yeah, absolutely. Because I mean, we're nurses. Like, we're not trying to diagnose or do anything like that, but we do have that doctor there that can actually see the patients, establish a plan of care, and kind of get the ball rolling.
Yeah, and get you out of the regular emergency room, right? And seeing that specialist that is trained specifically for pregnancies.
OB. Correct.
So
we used to only see 20 weeks and above, and more recently we've changed it to 16 weeks, which is a great thing if you've got somebody that comes in, say they're 17, 18 weeks, and they're experiencing something that really doesn't need to be seen in the ER, like if they're having any kind of vaginal bleeding or cramping, we're going to evaluate that. So you're not going to be sitting in a waiting room in the ER waiting and worrying. So this way you can get up to somebody who's specialized and they can evaluate you more quickly.
what would you say the most common concerns that you get, like, from delivering moms, or like the nervous, what are they most afraid of, or how do you best?
Epidurals.
Yeah, that
Needles.
makes sense. Yeah.
Usually it's either IVs or epidurals.
Yeah.
We're just by nature scared of needles. Like, it's just not a natural process. But I usually
and that one is like extremely long, right? Not the needle, but it's the tube that
they
go
see it
up
and they're
in
like,
the
"Oh my
spine."
gosh, that can't be."
Yeah.
But honestly, in the throes of having contractions,
Right, and that goes out the
99%
window.
of the time, people are like, "I do not care
Yes.
what is going on right now." But we also have classes that kind of explain that. So if you've got some fears, like, we have an awesome lactation consultant that teaches all of our childbirth classes. Her name's Caitlin Hudgens. She's a previous labor and delivery nurse, but once a labor nurse, always a labor nurse. But she is our lactation consultant and teaches those classes, so she can kind of alleviate some of those fears because she'll walk you through the whole process ahead of time.
Yes, because we have childbirth, postpartum, and epidural classes, and then also breastfeeding classes.
And she teaches all of those. She's amazing. She with the childbirth class, it includes the epidural process. Each of those, whether it's childbirth or breastfeeding classes, those are all 2 hours long. You can sign up for them on the SGMC website. They're free of charge to all of our patients. So if they're interested, that's available. But what they do, she spends the first 30 minutes of those classes talking about the epidural. So if that's strictly your only interest, you can come in, do that part, and leave. And she'll tell you, like, if you don't have any interest in this other part, like if you've had several babies and you just really want that epidural portion, that is totally fine. But the childbirth class walks you through, like, what to expect during labor, like, kind of like our available things as far as, like, the cord blood and the placenta donations. She gives you the information about the epidural. They also do a tour of labor and delivery, postpartum, and like outside of the nursery. So you kind of know ahead of time where you're going to be and what the rooms look like. With the breastfeeding class, she walks you through techniques to use. She includes the epidural portion. So again, like, there's more opportunity to have that epidural class information if you need it. But the breastfeeding class is just that. Like, it's going to allow you to, like, go through techniques, what to expect, like things as far as, like, holding techniques and like what to do if you have any kind of engorgement and all the different things that can arise. And then she comes and sees every patient once they deliver. She actually sees them in labor and delivery beforehand, which is really fantastic. And then she kind of establishes that care and checks in on them afterwards. And not everybody chooses to breastfeed. Totally fine. So my opinion is feed your baby. I'm happy.
You do it. You do you.
But whatever's going to make your life easier,
Yeah.
yes. But even the ones that aren't breastfeeding, she kind of follows up with them as well, just to make sure that they know how not to have that engorgement happen so that they have less problems afterwards. Yeah. So that's available even after you leave the hospital. You can set up an appointment with her, like, kind of follow up if there's issues that arise even after.
I think that's nice, and probably needs a little bit more awareness. Is just because when you are in the hospital and you have a child, it's obviously
slightly overwhelming.
Yes. And you get home, and my son, it was really fussy, and it was my second child, and I was like, oh no.
Well, every
I've
kid's
got a
different.
fussy baby.
Yeah.
Like, oh no, this is not going to be good. I remember thinking that. And we got home, and he was in one of the little swings, and he kind of like burped up some blood.
Oh no.
And I was like, oh God, what is this?
Red alert.
But I called up there, and they said, oh honey, that's probably just, he probably ingested some of the placenta fluid, whatever, and it's on his stomach. So that was what was causing him to be fussy. And then he was like super happy, but I never had to come back in or anything like that, where they were able to alleviate, any concerns right there. And that was definitely helpful. And then he was not fussy anymore, which was greatly appreciated by me. But just having that access, that not feeling, not being afraid to call back up here and talk to.
Yeah. And like a lot of people are concerned that their baby's not getting enough. And I mean, it's hard to know because when they're breastfed babies, like there's no like evidence of looking at a formula bottle that says like they've received X amount of cc's of formula. So Caitlin's there like as a resource for those patients, and like she's awesome with our patients. She's really an asset.
Common test that you do on newborns?
They do the PKU screening, which is going to be done 24 hours after birth. It's a send out. We usually tell people if no news is good news, you're probably not going to hear anything back, but it tests for different metabolic disorders. They like send that off. If there's anything going on, there is a follow-up. But again, no news is good news on those kind of things. As far as vaccines that they normally give, they're going to talk you through everything, but the common ones are usually erythromycin ointment in the eyes, and the vitamin K vaccine, or shot, I should say. And it's to help protect babies against brain bleeds because their blood can't clot properly when they're first born. And they'll offer the hepatitis B vaccine. I like to tell people that that's kind of up to them. If they want to delay that a couple days or talk to their pediatrician, totally fine. It's their baby. I try to make sure that they know that like we're open to whatever, but those are the common ones that we do give.
Okay.
Can you talk to us a little bit about the Safe Sleep initiative that we've been working on?
So Kendra Butenshine, who is one of our amazing NICU charge nurses, she kind of spearheaded that whole initiative. It is a program where each baby that's born in this hospital receives a swaddle, but it's way more than that, but that's what everybody receives. So when the patient is first admitted, and by patient I mean mom, like whenever she gets over to postpartum, they're being talked to by the nursery nurses. They give them this swaddle. It's to help those babies, to remind parents, like lay them on their backs to sleep. That's the safest way. We're trying to prevent SIDS in any way possible. But the big thing of Safe Sleep Initiative is that each patient is screened to make sure that baby has a safe place to sleep once they get home. We don't want to have babies being in like the king size bed with all the blankets. Right. That baby needs a crib or a bassinet or a playpen, like some area that they have that's all their own, that's free of toys, like anything that's going to be like
could suffocate them.
Detriment to that baby. And if they don't have that, they will set them up with resources in order to get them a bassinet. Because what we want is that baby to have a safe place to sleep once it goes home. We know those babies are here and like they're in their own little bassinet here, but once they go home, a lot of people just don't have the
When so many
resources.
people tend to like throw the little blankets in with
they want
the crib,
all the cute blankets. And I get it; they're very cute, but they also
the bunny, the teddy bear,
smother a baby.
and you really don't think about that.
No, you don't.
I mean, that is
because it's like the most common gift I would imagine is
Right.
like a blanket. So you're going to throw all the fuzzy
you don't
cuteness.
want it to be cold, right?
Exactly. But yeah, so it's making sure that those babies, like once they leave the hospital, the care doesn't end there. We want to make sure they have a safe place to go once they're home.
Yeah. So those that qualify get a free bassinet.
Correct. So they set them up with that. So that they do have a safe place to sleep once they're home.
And shout out to our foundation. They actually fund the bassinets, the travel bassinets that go home with the mothers, and also
the sleep sacks.
The sleep sacks.
Yeah.
Now, have you ever heard of the Berlin baby magic jumpsuit?
Oh yeah, where they look like the Michelin Man.
Yes, and basically, I don't know if it's like humane, and like my parents didn't like it. They're like, "Can't believe you're putting your child in that," but it's like a jumpsuit that's like weighted and keeps their hand and makes them stay like asleep and look like a Michelin Man. But those things are magic Merlin baby jumpsuit, if I can help anybody out there. But they definitely can't roll over in that thing.
No, they're not going anywhere in those.
They will be safe sleeping in
nice.
that.
Absolutely. Do they have adult size?
I know. I would like one for me.
I think those are weighted blankets for us.
Yeah, I think so. Yeah. Best part of your job? I mean,
honestly, like every day is awesome. I get to establish relationships with patients that I wouldn't have met otherwise necessarily. And like the awesome part is like having patients who have had babies before and they come back and they're like, "Where's Lara? I need Lara." Like second, third, fourth babies. I've actually gotten to be a part of a family of 6 where I've gotten to be there for all of them. It's just really cool because it's a really intimidating time for that patient, like to that they allow me to be a part of that process, like any part of it, like starting their IV or like taking care of them from start to finish. Like it's a very intimate time in the sense that like
you're vulnerable,
very vulnerable. And like I try my best to come in every day and like make that experience for each patient what they want. But like them allowing me to be there is just incredible. So it's really cool to see some of those babies grow up and get older and like be able to still kind of keep up with them if they want me to. Like,
well, it's weird coming from a patient side is you do remember your delivery nurse. Like I don't remember the name of my delivery nurse, but I remember what she looked like, and I would see her like later on. And I know she probably didn't remember me from Adam, probably, but it's you've got that. You're so reliant on that nurse. Like, help me, please take care of me.
Well, and I mean, the way I kind of have always looked at it is, it's like 99.9% of the time, it's like the happiest day of somebody's life, and it's not just any day for them. It's not just like me going into work. Like it is a huge, huge life. Like, I mean, they're going to remember every bit of it. And for those that it's not the happiest day of their life, it's my job to help them get through that in any way that I can. Because unfortunately, not everything goes well all the time.
And we talked about that earlier, that it is such a high-risk event in a mother and baby's life. And unfortunately, y'all have to deal with the deliveries and miscarriages and all of the other things too. And I can't imagine what that's like from y'all's perspective, but I have heard from other patients that have experienced that they're just so grateful to have people like y'all there to help them go through that, because that's such a vulnerable time too.
Absolutely. And I think it's important that they see that we're human too. Like it's not easy for us to take care of somebody, but it's a privilege for me to take care of somebody in that situation. So I think it's really important to just remember every day, it's not about me, like it's about them. And I'm grateful for the opportunity to be a part of that story.
Do you have any tips to leave us with for the mom who's going to come here? She's going to be in labor and it's going to be scary. Do you have any tips that you would like to give?
I think my biggest thing is like, don't have expectations, but have like a kind of an idea in your head of what you want, and don't be afraid to tell us. We want that to be a good experience. Like we said, sometimes things don't go according to plan because we can't predict how a baby is going to tolerate things or cooperate. And sometimes they're just not cooperative with what we want to do. But I think the biggest thing is like, don't be afraid to be an advocate for yourself. We're all on the same page. Like, I want this day to be what they want it to be. So if you've got something that you want, if it seems crazy, if it seems like a dumb question, I promise I'm not there to critique or ridicule. I'm there to help. So just don't be afraid to ask me, or like go for the goal here. Like what do you want this day to be? So I think it's just really important for them to kind of know that I'm on their team and I want this day to go as well as they do too. And if they don't want certain people in there or they want certain things, that's okay. Like just tell me and I'm going to make it happen as much as I can.
Good to know, everybody. Lara's the nurse that you want to have. Not that all of our nurses aren't fantastic.
No, we have an amazing team of labor and delivery nurses up there. We've had a lot of new ones that have come in the last couple of years, and like we just really have an amazing group.
Yeah. We are constantly getting positive reviews about our ladies in pink. So if you don't know, if you work on our second floor, which is our labor and delivery and postpartum and NICU, all of those ladies wear pink scrubs. So that signifies that they care for our mamas and our babies.
And it's my favorite color, so it works.
There we go. Yeah, there we go. It's very relevant these days.
It definitely makes you stand out, like in a good way. Like, oh no, that's a nurse that works the second floor. Like, it's very easy to spot us in public.
Yeah. And it looks good on you.
Oh, thank you.
Well, you want to ask your infamous question?
Yes, I do. So I know you nurses probably work like crazy hours. So you probably have to eat here a lot.
Oh, yeah. Mm-hmm.
So what would you say your favorite food is, either in the cafeteria or in the spice?
Oh no. Okay, so I'm well. If it's not something that they cook, let me preface this with the blue raspberry Sour Patch Kids. I need to be in stock all the time in the.
I don't think they make those.
No, they don't make them, but they supply them.
Yeah,
They're there.
They have
4
them
p.m.
in
hits
the
on a busy
vending
day,
area.
and that's my snack of choice. I mean, if you're going to go down to the spice, you've got to have something that's like. I mean, their Philly cheesesteak.
I know, yeah.
Man alive, that thing is good. Let me think. I got to think about. If you whenever the cafeteria does the dessert bar, oh my gosh, my sweet tooth is talking today.
I can't even go down there when
No,
they
I
have the
can't
dessert
either.
bar because
No,
I can't look.
I cannot resist it. Like that's just part of it. But honestly, people are always scared of hospital and cafeterias. Like the food, ours is pretty good.
Ours is good. Ours is
This
good.
is the consensus. Everyone we've asked that the
Yeah.
food is good.
No, that's why I have to bring my lunch because otherwise my entire paycheck would be spent down there.
This is true. This is true.
I
They
bring
do a
my
little too
lunch
good.
too.
Well, we are grateful for you being here with us today and sharing a little insight of to what you get to see on a daily basis, which sounds like a lot of fun. I know sometimes we get to go up there and see our nursery and we get to see, peep through and see the little babies.
Our cute little
and
babies.
the nurses that work in the nursery, they're always just, just nonchalantly holding a baby while they're, charting and stuff. It's so unfair
It's nothing for
that
us
you
to be
get
snuggling
to
a
do
baby in one
that.
arm and doing something
Yeah,
with the other.
that's not fair, but anyways, or thank
Perks
you
of
for
the
what
job.
you do. That's right. That's right. But if anyone has any questions or wants to learn more about the birthplace or labor and delivery here at SGMC Health, feel free to check out our website or leave us a question and ask for more information. We are happy to reach out and answer any questions you have. And with that, I think we're done with today's episode. So we just thank you for listening and be sure to like and subscribe to our podcast, What Brings You In Today. And we look forward to seeing you soon.